Resuscitation and Code Team Job Aids. An instructional video for code and resuscitation teams. Job aids organize task priorities, standardize activities, prevent inadvertent oversights, allow faster and more thorough completion of tasks and reduce cognitive load. They prevent leadership distractions or task drift, ensure a consistent structure to the resuscitation process and decrease team stress. Job aids transfer resuscitation team activities and steps from deliberate cognitive processes to more automatic responses. Industries requiring high-precision performance commonly utilize job aids. Job aids can be checklists containing specific task elements for which accuracy and oversight prevention are mandatory. The pre-flight checklist used by airline pilots is a classic example of a job aid. There is a significant body of evidence supporting the benefit of checklists in code and resuscitation settings. Here are just 3 of many articles providing proof of benefit from checklists. The room preparation checklist and the ED transfer checklist are important checklists that can be used during the anticipation phase or the transfer phase for a patient. A wallboard or poster demonstrating team member positions relative to the patient bed as well as their duties is another helpful code team job aid. The roles, duties and locations of specific team members can also be displayed as a wall chart. Such a chart is especially useful in training center settings where team members regularly rotate. Dry erase boards can assist with documentation of the pre-hospital history or list individuals for team role assignments.
Posters containing clinical reference information can be strategically placed on resuscitation room walls. Inexpensive wall posters can be purchased at www.nonapps.com.
Folding pocket emergency medicine reference cards loaded with rapid access adult and pediatric information can also be useful. A pocket card job aid that includes code team organizational steps and commonly used code team checklists can also be helpful. Another important job aid is the Broslow/Hinkle Pediatric Resuscitation System. The Broslow tape has become a standard piece of equipment for most emergency departments. Based on the child's length, this system quickly estimates a child's weight, calculates drug doses and guides equipment size selection. Scores of emergency medical reference applications are available for smartphones.
The most common example of a job aid already used widely in resuscitation settings is the ABC's mnemonic for guiding patient resuscitation priorities. The secondary survey is taught in the Advanced Trauma Life Support course, but it is excellent for medical codes as well.
The surveys provide a common organizational structure to the code team. As part of the code team leader script, the current survey should be communicated to the other code team members. For example, the primary survey is complete, and now we are moving to the secondary survey. The primary survey, a physiologic survey, prioritizes areas of clinical focus and identifies life-threatening conditions. A. Airway maintenance with restriction of cervical spine motion. B. Breathing and ventilation. C. Circulation with hemorrhage control. D. Disability, assessment of neurologic status. E. Exposure/environmental control. The secondary survey does not begin until the primary survey, ABCDE, is completed, resuscitative efforts are underway, and improvement of the patient's vital functions has been demonstrated. The secondary survey is a head-to-toe evaluation of the patient, a complete history and physical examination, including reassessment of all vital signs. Each region of the body is completely examined. Both the primary and secondary surveys have adjunct phases. These adjuncts are the heart of the patient care delivery and include the various interventions, tests, and procedures performed during the management and evaluation of a resuscitation patient. Examples include electrocardiographs, pulse oximetry, end-tidal CO2, various monitors, ABGs, nasogastric or Foley catheters, ultrasound fast examinations, radiographs, and CT scans. When cognitive demand is high, the potential to overlook one of these adjunct interventions is increased. The use of a memorized mnemonic checklist is strongly recommended to prevent omissions as well as maximize the leader's speed at giving orders. Rapid consistent history acquisition is very important in efficient code team management and maintaining team leadership. History acquisition from the pre-hospital providers and the patient or patient family are the most common history acquisition events. Having a memorized history mnemonic can markedly increase efficiency and consistent data collection. The ample patient history mnemonic is one example. However, there are other similar useful mnemonics to choose from. The victim's mnemonic ensures that you will obtain all the important information needed from pre-hospital personnel. The impaled mnemonic is another version of the ample history, but with some additional, helpful information. CPR rate and rhythm job aids. There are also tools to help guide rate and depth of chest compressions. A simple and commonly used tool is doing chest compressions to music that plays at around 100 to 120 beats per minute. Here are some examples. To achieve optimal chest compression depth, victims of cardiac arrest should be placed on a firm surface. Backboards are placed between the mattress and the back of a patient in the attempt to increase cardiopulmonary resuscitation, CPR, quality. The evidence is excellent that backboards result in deeper, more effective compressions when compared to a soft mattress. Well-thought-out systems for resuscitation equipment location and display are also valuable to code team organization. The room location for equipment storage can affect resuscitation team efficiency. Minimize impediment of the floor space around the patient, especially near the head, by maximizing the use of storage, X-ray, and outlets. Well-designed equipment cupboards or open equipment carts allow easy visibility and access of supplies.
Thank you. Be sure to watch the other videos included in this code and resuscitation team organization educational series.